Hi, my name is Mary Esposito, and for my project, I looked at BMI and diabetes from the Nhanes data from 2017 and 2018. For my background, I found data available for 2021 showing that in the US, adults 18 and older, the incidence was 1.2 million. The prevalence of diabetes was 29.7 million for people of all ages. And it was found that 352,000 children were diagnosed with diabetes in this year, including those younger than 20. There are many risk factors that people are aware of diabetes. A common one is obesity, which is what I looked at. And all of these risk factors listed are ones that can be controlled as compared to ones that cannot, such as genetics, so smoking, overweight and obesity, physical inactivity, A1C, high blood pressure, and high cholesterol. And this data is from the CDC. For more on the background with the association between BMI and diabetes, it was found that the risk of developing diabetes with a BMI of 30 to 39.99 compared to those with a normal BMI was the same for men and women. And then once you look at a BMI over 40, the risk of diabetes becomes higher in men than in women. There is a strong association with BMI. The prevalence of diabetes has been seen to increase in studies as BMI increased, and there's a eightfold higher risk of diabetes compared with those of normal weight when you look at those with obesity. The prevalence of diabetes among obese individuals was 30.4% compared to 5% for those with a normal weight. So there is a pretty significant difference. This is a graphic. So it shows the rate of diabetes comparing normal weight at the bottom, overweight, and obese in America. And it goes by age. So as you increase in weight, the rate goes up. So when you look at normal weight in all ages, it reaches above 10%. Overweight reaches above 20%, and then a high jump when you look obese, it reaches 40%. And it is important to note that not all individuals that are obese will develop diabetes. It's not a given. And some individuals that have a normal weight can develop diabetes. But the odds of being diagnosed with diabetes are higher among those who have a higher BMI or who are obese. That's showing those association. For the methods of this study, the Nhanes data was used, and Nhanes monitors trends over time. Nhanes is the National Health and Nutrition Examination Survey. So the data is from there. And the way the survey was done is that data was collected through interviews, physical exams, and lab testing. And this is a picture pulled from the video of one of the trailers. These trailers go all over. 4 of them are often connected to do these physical exams. And when doing this survey, a complex multi-stage probability design was used to sample civilian non-institutionalized population residing in the 50 states and DC. 16,211 individuals were selected from 30 different survey locations, and of those 9,254 completed the interview and 8,704 were examined. For the analysis that I did, I looked at the exposure of BMI and the outcome of prevalence of diabetes. That was a doctor had said that they had a diagnosis, and this was the patient or the participant reporting this. The data was analyzed in Stata, and I ended up doing a Wilcox and rank sum test since the data was not normally distributed. And this is because when data is not normally distributed, the median is a better representation of the data versus the mean. So for results, we're mainly looking at the diabetes diagnosis compared to in all the categories: BMI, underweight, normal weight, overweight, and obese. And it was found that obviously, as you can see, as you go higher in the categories towards obesity, there is a higher amount of those diagnosed with diabetes, and the p-value was found to be statistically significant. And then I also looked at high cholesterol, since that is another risk factor that a lot of people look at. And that also increased as we got to the obese category, and was also found to be statistically significant. And I just looked at this as another thing to consider researching more into, another research idea of the correlation between high cholesterol and BMI and its relation to diabetes. So the relation that was found between BMI and diabetes diagnosis gives us insight into what we can focus on to prevent diabetes. Oftentimes, we just focus on the medical issue of diabetes and not obesity as a whole, and not obesity in public health. And public health can focus on initiatives to decrease obesity rather than waiting till it gets to the point of diabetes and treating it with medication that is necessary at that point. When people are in an obese category, weight loss of 5 to 10% of baseline body weight is recommended as the initial goal of treatment. And something that we did in one of our classes was go into the community and measure people, take their weight and get their BMI. And we would show them what 5 pounds of fat looks like, and we would give recommendations, information on diet, and give recommendations on how to exercise and what length of time. And I think that was like something that could make a big difference, because a lot of people don't really know, and they don't know that that's something they should be focusing on. So a policy recommendation is for there to be better access of healthy food in food deserts and food swamps, which is a barrier to combating obesity. This is pretty typical because when people don't have access to nutritious food, they go out and buy really cheap food like McDonald's, where you can get a full meal for really cheap as compared to going to the grocery store. So if it was something that was mandated where people would have access to healthy food, then that could prevent obesity. Public health program planning can be done to allow those with lower income to have access to nutritious food and education to prevent obesity. Something else that from working in a doctor's office that I've seen is sometimes people have done the diet, they've done everything, they've done exercise, and they still can't lose any weight. So they get put on weight loss medications, and these can be upwards of $3,000 a month, sometimes more. And a lot of times insurance does not cover these even after doing a prior authorization, and they refuse to cover any weight loss medications. And I think that if it's proven that they've done everything, these medications should be covered by insurance companies, because it can prevent obesity leading into diabetes, and then other medications will, no matter what, be necessary. So rather than letting it get to that point, I think that it should be something that should be changed as well for another future idea. Some strengths and limitations. Strengths of the Nhanes data, it's a large and representative sample, and there are a lot of health indicators that were looked at. And also a lot of demographics, which is good for us to see rather than just focusing on one thing and not really having a good idea of how BMI and other factors like cholesterol impact diabetes. The survey is done by a trusted government agency. Some limitations are that it's self-reported data bias. Some people may not remember what the doctor had told them and may not remember what they've eaten, stuff like that. So some things can get lost there. Some areas can also be underrepresented due to geographical limitations. If someone is in a really remote location, then that area may not even be considered in the survey. And they could be impacted by food droughts, so that data could be valuable. There could also be missing data due to survey questions not being answered for whatever reason. This is my appendix. So I categorized BMI and then found that BMI and diabetes were not normally distributed, and then did a rank sum Wilcox test, and found that it was statistically significant, and I did the same for high cholesterol. These are my references. Thank you.